Republican Congressman John Katko is the co-chair of the House Mental Health Caucus. His work on the issue of mental health access includes the bipartisan Mental Health Services for Students Act, which provides federal funds for schools to employ mental health professionals. Welcome, Congressman Katko.
Thank you for having me.
Well, let's talk about the Mental Health Caucus. How often do you meet? What's on the agenda? And what do you think you could get done by the end of the year? As you know, well, a lot of our audience knows you have announced your retirement, so this will be your last year in Congress, so I'm sure you're trying to move some bills through.
Yes, it's been good for my mental health to announce that I'm retiring from Congress, I can tell you that much. But we've spent a tremendous amount of the time since I've been in Congress. I mean, not just meetings, but with staffs and bills and initiatives. And so I can't really tell you how often we meet because it's sporadic, but it's frequent. And when we do meet, we meet and try to advance bills and advance initiatives. And I'm very mindful of the fact that mental health is one of the biggest killers of our children in this country. And the number 10 cause of death for all Americans is suicide. So we see it all the time. We see what happened in Buffalo the other day, the violent acts that respond from mental health issues and hatred that went along with it. But so since I've been in Congress, it's kind of been my mission to try and address the issue as best I can. And, I lost a niece to suicide when she was 21 years old. And I was very close to her, and that profoundly affected me before I went to Congress. It happened. And I learned that there wasn't a single bed in Syracuse that was inpatient pediatric mental health, not a single bed. And so, when I got into Congress, I started a mental health task force and locally, and it really informed me as to how bad the situation is and the lack of services for people. And it's really kind of driven what I've been doing since I've been here. I'm proud to announce that, to tell you that several years ago, a major hospital in Syracuse finally opened a pediatric mental health unit, and it's saving lives on a regular basis. So, it's a long answer, but the bottom line is there's not a day that goes by where I don't think about and work on mental health issues in Congress.
Well, something we talked with Congressman Cardenas about and talk about saving lives is the hotline 988, which will hopefully, and I imagine, save a lot of lives from people who need mental health, whether that's adults or kids or anyone calling it. Where do we stand now? Do you think that we're ready for implementation this summer? And do you think this will be a very successful program?
I do, and I'm really excited about it. It's going to be implemented, I believe, on July 16th. And the Lifeline has been significantly underfunded in demand services. Demand for services has been very high. So I passed an initiative or introduced an initiative, the Suicide Prevention Lifeline Improvement Act, which passed the House last year, would provide $38 million in additional funding for the crisis centers to meet the anticipated increased volume. So I think it's going to be incredibly successful. It's going to be successful because people are going to call. And people are going to not be put on hold or whatever. They know it's a dedicated line to call, that they can call just 3 numbers, remember, very easily. And people are going to be there to help them. The trick is to make sure that there's proper funding so there's no delays in assistance. I remember years ago being horrified to learn that in the VA arena, Veterans Affairs arena, that their suicide crisis hotline, people would call up and were asked to leave messages, or they were put on hold, or what have you. And obviously a lot of those individuals in the process of waiting took their lives. And so we've changed that. We want to make sure that bottlenecks don't happen when we go live.